Welcome to Inside Aesthetics, the world's leading podcast for injectors and aesthetic businesses. I'm Dr. Jake Sloan, an aesthetic doctor with over 16 years experience in facial aesthetics.
And I'm David Siegel, an entrepreneur and business mentor with over 20 years of experience in our industry. Our podcasts are aimed at industry professionals, and any information or advice given is general in nature. You should consult with a healthcare provider before undergoing any treatment.
You can also subscribe to us on Patreon for on-demand content for injectable and business education.
I'm very excited for this episode, Jake.
You've been frothing about this for weeks.
Very, very excited.
So, take it away.
Take it away. So, interesting timing because we've got a lot of stuff going on in our industry at the moment. We've got new regulations that have been passed down by the TGA and AHPRA, advertising restrictions. We've now started to see the convergence of aesthetic health, regenerative health, and aesthetics. And it's sort of coming at a time where our industry has come under a lot of scrutiny and regulation. And I think people are now starting to, look at ways they can diversify their businesses or their practices and upskill themselves and offer more than just cosmetic injectables. And there's also been this parallel trajectory of aesthetic health and regenerative medicine happening alongside aesthetics, and it seems like we've suddenly reached, well, not suddenly, but inevitably have reached this meeting point where the two things now seem so obvious that they should be working together. And today we're joined by Dr. Isabella Sillar from Melbourne in Victoria, and she's here to talk to us about the future of aesthetics and what it means to be an aesthetic practitioner in the future. And I've been talking about this stuff for years, and it's interesting to see they're actually finally having this discussion and introducing people to the topics more broadly. So today's conversation is going to be a fairly general discussion about what it means to be an aesthetic practitioner. We'll talk a little bit about Isabella's background and sort of how she's ended up at this point, and cover a lot of different topics. And I think we'll then circle back later on down the track and cover some of these areas specifically. So today's going to be a lot of information covering a lot of topics, and then stay tuned for future episodes.
Very excited. Yes. And, in our last podcast, I was recalling my recent trip to Monaco, and, for the last 3, even 4 years, certainly at the big major events, they are dropping in, or not even dropping in, regenerative medicine or anti-aging medicine, whatever you want to sort of label it. And Izzy can tell us what she thinks it should be called. It's now a mainstay of most of the aesthetic conferences. It's kind of logical. If you want to look good, you got to feel good, and vice versa. And that's where the podcast kind of started. We actually touched on many of these topics years ago, and then we sort of went back to pure aesthetics for a while, and now here we are dovetailing them again. So interesting.
So Izzy, tell us a little bit about yourself. So why did you choose medicine as a career path? I mean, we were talking on the phone a few weeks ago, and I was astounded after talking to you and you're sort of getting an understanding of how knowledgeable you were, how young you are. And I'm not saying it's surprising to me that we're here now, and someone that's, I guess, fairly new to this whole world has already taken such a great leap forward in educating yourself and having such a fresh perspective on things. So just tell us a little bit about your background, as I said, why you got into medicine, then how you found yourself pursuing this form of medicine, like functional integrative health.
Absolutely. I love having a joke, just an aside, with my patients that I'm actually 40 and I'll deliver to them deadpan, and it's probably a form of gaslighting. I should stop doing it, but it's always a good practical joke. And then I obviously look incredibly young. So it's part of the pathway, I suppose, being in this aesthetic field. So myself, how I see myself as a clinician and as a person, I think part of my identity is being a clinician, but it's not my only identity. Being a person first and foremost is the most important thing to me. So as a clinician, I feel that I am a translator for people. People come to me with their concerns. My job is to translate what their concern is to me and really understand it, to translate why it has happened, what is happening, and then what we are expecting to happen over the next 5 to 10 years, and then into the future, not only from an internal point of view, but how they're going to respond to the procedures, what I'm expecting their maintenance plans to look like. So really translate up the less uncertainty there is around what I'm delivering, the more comfortable they're going to be with me. So as a translator, I obviously need a really amazing team around me. And it can't be the me show. Like, I haven't gotten to this point just with me. It has actually been a huge part of the early cell community and the team that I am a part of. We've got specialists in each of our areas that we've got me in the medical side. I've got my dear friend and mentor, Rachel, on the business side of things, our clinic and marketing manager, front of house, and also our accounts team. We have a really, really strong group of people, and that is ultimately what has catapulted us so quickly through this industry, because I've been able to flourish so well. And then it's just, the background of what's driven me into medicine has then been given the opportunities to grow. And as I was mentioning, as a person, I see myself as a lover of life. I'm really fortunate to have such incredible capacity to do all of these different things and to feel well while I'm doing it and to love it. So, I love my sports. I love being outdoors, particularly boxing and mountain biking. I'm actually hoping to compete in boxing later this year in the pro circuit, which is a bit questionable for a doctor trying to protect their brain, but that's okay. It's all about the opportunities. And then I think what has made me really appreciate, medicine and health and wellness is two key things that have happened in my life. So growing up with two cousins with Duchenne's muscular dystrophy, unfortunately, it's a really horrible disease where cognitively they're intact, but they don't have the capacity to make muscle proteins. And, by the age of 10, they're completely wheelchair bound. By the age of 15, Josh was bed bound, and they passed both, one at 21 and the other at 26. So having that very close relationship with mortality and morbidity throughout my formative years, and then also during med school, I got really, really sick. I had to defer over 6 months worth of training. I had to move home with my parents. I was completely bedbound for about 2 months. And I remember the day when I started getting well, I was actually able to walk more than 50 meters. And so I've had this incredible path of, illness within my life and external to me, and then to grow into where I am now and being well. That's the greatest gift that I can give someone. And it just so happens that I'm also really artistic, and I get to work within the aesthetic industry. It's just all starting to come together. That's a little bit about how I've gotten into medicine and aesthetics. It just evolved from, doing physician's training, being given this opportunity, and then realizing that I had, it was either illness medicine or wellness medicine. And wellness medicine and aesthetics was just so much more accessible to me, my skill set and my capacity, and I just can't see myself going back.
Izzy, you're the second functional doctor we've had on. We had someone back in episode 56, Dr. Vinny Singh. So we kind of covered what integrative medicine is. And I don't know if you call yourself an integrative doctor. I'm not quite sure how you describe yourself. But what did you actually train in hospital? What was your pathway? Did you do GP or hospital? And then, how did you get into this?
So a really good question. So I can't call myself an integrative doctor because I'm not a specialist with the integrative, college. So started off doing physician's training in the hospital system. So did internship, started physicians. During my first year of physician's training, I was working full-time in Traralgon Hospital doing that arm of things. And then I was working part-time at Elucel. So it was pretty hectic. I would drive 2 hours on my half day off and then 2 hours on after I finished my clinic to get home. So I was doing physician's training. I loved it. I was so convinced I was going to do physician's training. And as I was doing that and then running the business and my clinic was starting to get more and more busy, I was working alongside nurses at the time. It became pretty obvious that my capacity was better with wellness and the aesthetic industry. And obviously being so early in my career, you deal with a lot of uncertainty. You don't want to make mistakes. You're dealing with people's faces, their health, and having seen the impact that sickness has on people in the hospital system, you never want to then go into a non-essential medical practice and then go and cause harm. So the way that I fortified myself in all of that was I did all of the in-person courses. I found, mentors in plastic surgery, in clinical GPs who could support me whilst I was gaining those skills. For the first few months, particularly in the aesthetic side of things, I was working part-time in another GP practice who oversaw my training whilst I was getting the hours under my belt, whilst I was attending those courses and getting the certificates. I've done certificates in clinical dermatology. I've done certificates in PRP, pediothreads, all your dermal filler courses, that sort of stuff. So just be really equipped to be able to manage my patients and what their expectations were of me. So with this whole shift that's happening now in the aesthetic industry within Australia, we're now finally being recognised as a specialty. And that is so, so important because we now have fellowship pathways opening up for us. So I'm doing currently the fellowship pathway with the Australian College of Aesthetic Medicine. I'm also doing a fellowship pathway with the American Board of Regenerative Medicine. So structured learning is so important. But honestly, it's the mentors and the people who have 10, 20 years experience on me. Affiliating with them has been the most important thing I could have done.
Yeah. I think what makes you different from Dr. Singh, who we had on early on in our podcast career, if we can say that, was you're the first doctor that we've had on, or clinician that is doing both of these disciplines within one practice. So I think bringing in all the injectable treatments plus looking at this side of things, it's a first for us. So that's what's so exciting. We were talking off air and sort of Jake was sort of talking about questions that we're going to run through with you. And one of those that came up was, why do you think there's been such a resistance within, I guess, the Australian medical community for regenerative health? It's sort of been, deemed as quackery or shunned upon, or you found yourself coming under extreme pressure and critiquing from the powers that be. Is that still the case? And if so, why? What do you think's driving this, or was driving it?
I think, honestly, we can the line in the sand from when I saw the shift happening was COVID. Like pre-COVID, like everything was so medicine 2.0, and we're making, our goal was when the patient presents with a problem, what do we do to treat the problem? And then COVID just blew everything out of the water, and people suddenly became very aware of their day-to-day health. So they might not have been sick, but they certainly felt like rubbish. They weren't seeing their friends, they weren't going outside, they couldn't do exercise, and people were just feeling rubbish. And so I think, that also affected clinicians. And I honestly just think that the reason why it was rejected in the first instance pre-COVID was because clinicians weren't forced to experience what it meant to be unwell or to not be functioning at their very, very best. And then when we went through that whole transition phase, we're now at the point where it's like, maybe medications aren't the only answer to everything that we've always known. And our training is commercialized through, you learn how to solve a problem, you get into the system, and then you continue to solve those problems, treat those problems. Our job isn't to prevent people from getting those problems. Our job is to, treat when they break, because we know people are going to break. And so there's resistance because we lose staff members from the hospital system and from the public healthcare systems when they go off to do just research, or they go off to do non-clinical medical fields. We're trained from university to become clinical doctors. And so it was just a mindset thing. The normal pattern around us was you do clinical medicine, you become a specialist, and that's the pinnacle of your career. Whereas now it's be a healthy person first and foremost, enjoy what you do, and then give back to your patients and find out how you can do that in the best possible way.
If I can get some insight as well, I'm a medical doctor as well. And, my wife, she's trained as a naturopath in the UK. And so she's introduced me to functional doctors, etc. And I've been to some of the lectures that she's attended. And, I felt out of place because I wasn't trained in any of this stuff at medical school. I wasn't taught about nutrition, gut health, maybe even some of the mental health stuff. So I sort of sat there kind of going, I don't understand this because I wasn't trained this way. And it's not me saying it was wrong. I just didn't know how to comment either way. So I sort of felt as a doctor a bit disarmed. So I think that's possibly why there's some resistance, because it's sort of outside of our scope of practice. And, and we're not armed to deal with these questions from our patients either.
Exactly. It's that grey area of, and falling into, you don't know what you don't know. And like you said, we're being trained to fix a problem. And when patients come to us and go, well, how do I prevent the problem? We're like, it's a good question, because we don't even know how to do it for ourselves. During physicians training, I was watching my colleagues who are in their late 20s. It was just synonymous with training. You put on 10 kilos, you become really tired, you become depressed, but you sacrifice your health to get to the end goal of being a specialist. And so it becomes justified that we sacrifice our health. And unfortunately within medicine, that's the way it's always been. So when patients come to us and go, what can I do to not sacrifice my health in the long run? Or what can I do to build my health? We actually sit there and go, honestly, we don't even know, because we've not even been trained in this.
Yeah. It's interesting, isn't it? It's such a, when you step back and look at it, and particularly from me, from a non-medical perspective, I take my car to get serviced, a few times a year. I change the oil, I change the filters. My mechanic looks at the donor, asks what kind of fuel I'm putting in the car if there's a problem, and I'm taking care of my car preventatively. I don't wait until I've, destroyed a cylinder block or
Exactly.
its engine seizes before I take it to the mechanic.
Definitely.
But we only deal with health traditionally or historically. We only go to see the doctor when we're sick. We're not actually going to the doctor to say, hey, doc, I'm here for my regular blood work. Is everything looking okay? Is there any problems that might be presenting themselves down the track? Do I have a low level of intolerance to something? Have I inflammation markers up? Am I deficient? Why do you think we just haven't looked at this the way that we look at all other things that go on in our life? And I mean, the car analogy is something that anyone listening to this can probably relate to.
I love the car. I really do love the car analogy. Also, because it's the reason why aesthetic medicine is, just as a tangent, is transitioning into this regenerative and wellness medicine. You don't go to the same mechanic because your oil light keeps turning on and he can't or she can't tell you why, but they keep fixing it and charging you. The same for aesthetic practitioners. If you go to someone because people keep telling you you're tired and they keep fixing you, but you regress rapidly, and they haven't told you why, they haven't given you the solution or, the tools to reduce the frequency at which this is occurring, you lose trust and faith in them. They clearly don't know what they're doing, or they don't know how to make your results better. So that car analogy is so important, not only from the way that we perceive our bodies, but also the way we should perceive ourselves as practitioners. We should know why we're treating for something and why this person is presented in this way. In terms of within the medical industry, it's because mostly our health, and we're so lucky for this, public health is what has driven most of Australian medicine versus private health. And so with the car or the mechanic kind of reference, that's a completely private employment. You're paying them as a business. Whereas when you go to a GP, the government is mostly paying them. And we're starting to see that shift now towards actually paying people for their time, paying people for their knowledge, and really appreciating when, we have physicians who will go that extra mile to help you become better, rather than just being like, yep, sick, you're not dying, great, get out of my office.
Yeah, fair. So how would you define what functional or regenerative medicine is, or are they different?
So this question's really interesting for a few reasons. I think firstly, it's because it is a grey area. I think, I think in time we're actually just going to see the two definitions come together, and they will be considered part of the parcel. For me, at the moment, functional medicine is really considered the overarching, the umbrella specialty. It's about keeping people having capacity, maintaining and fortifying their bodies, and, being able to either recover from illness, recover from a disease state and cure themselves, or at least be able to manage the disease state. Comparatively, you have regenerative medicine, which is purely focused on fixing what is broken, or helping rebalance the system. So I think functional medicine is the concept that we're aiming for in total. And I think regenerative medicine is going to be an arm that will sit underneath functional medicine.
Right. So how do you train in functional medicine? I mean, I know there's many courses. It's pretty big in America from what I can see. Whereas at least when I lived in the UK, I don't think I'd even heard of it, but that's close to a decade ago now. And then here in Australia, it's a bit of a hybrid. It's certainly more popular than Europe, but it's not quite at where America is. So How do you train and what's involved?
I mean, it's just one of those areas that it's still evolving, and it's in its infancy. And so I think with functional medicine, for you to be the goal is always to be a really good practitioner in what you are able to deliver to your patients. And I think to be a functional medicine clinician, you have to have an appreciation for what your capacity is, what is your passion, and then know where to refer out when you get into arms of functional medicine that just don't interest you. Because if you don't have an interest, you can't care for your patient, and then you give substandard results. So I think to train in functional medicine, find out what makes you really passionate and then really pursue it. So for me, it's female hormones. Absolutely. So endocrinologists, doing coursework, doing research, following a lot of podcasts surrounding, what our understanding of female hormones is. And I'm looking to affiliate and do research with an immunologist in America on women's hormones and inflammatory processes. Like, that is just my thing. But in terms of gut health, I have a basic knowledge and understanding of what it means to have a functional gut, but is it something I'm going to sit down with the patient and talk with them for 40 minutes about? No. But there is so much out there for us to be able to access, and really good coursework that does provide the framework for us to be able to deliver our passion effectively.
Yeah.
I think that's really interesting, because my concept of functional medicine, which is clearly wrong, was that you're almost like a master of every body system, and you've got to almost be a biochemist, and everything interlinks. And it's almost like learning a completely new language. And that's what confused me. When I looked into it, I was like, I don't understand this. It just seems too different.
It's impossible.
Yeah,
and it's actually impossible. It's the concept of a generalist, but even a generalist can't do, the naturopathy side of things, can't do the myotherapy, you can't do all of that. And I think it's accepting who we are as an individual and what is going to allow us to give the best possible results to our patients. That's what we need to be chasing.
Yeah.
And we fall under the umbrella of functional medicine.
So for people that are listening to this, whether they be doctors or nurses, and obviously we're going to cover a lot more during this discussion, but I think the obvious questions to them would be, well, where do I start? Where do I even, begin to get a general understanding of what this is all about? And I know that you've worked with the Australian Academy of Dermal Sciences. I think they're situated over in Western Australia. So I know you've designed some course curriculum with them, and you're working closely. So, are they the place to potentially go? Are there other educators in this particular field?
So I think when you break down continued education as a clinician, you need to be realistic with what your time availability is. I'm very fortunate because I'm single, I don't have children, I don't have any dependents. So I have a lot more free time to be able to pursue these sorts of things, both in person and then also online structured learning. I think for people who are a little bit more time poor, the focus probably needs to be structured online learning and accessing, your approved training sites. And the AACDS is absolutely one of them. HealthCert is another. There's many of them. You just have to do a little bit of your research into what one is going to be able to provide you with what you need. Pretty much always start with a diploma. The diploma is your baseline knowledge, and then you can look to go on to whether you want to do your bachelor's and do it at university, whether you want to do your master's, a thesis, that sort of stuff. But your diploma is the baseline structure that you can obtain. Online structured learning is going to be the easiest. You can do that whenever you like. But then you also have your in-person trainings, which are going to be seminars, conferences, and then attending, clinicians, clinics who resonate with what you want to practice. So I think absolutely AACDS is awesome. I've really enjoyed working alongside them. They're doing quite a lot of varied content, and it is targeted at all the healthcare practitioners within the aesthetic field. So from dentists, nurses, nurse practitioners, and doctors, and then also all of those specialties who are in training and haven't finished their university degrees yet. And then we've got our fellowship colleges, which, CPCA, Cosmetic Physician College of Australia, ACAM, Australian Australian College of Aesthetic Medical Practitioners, where it's becoming more accessible. You just have to look. I'm more than happy to put together a list of my top ones that I like to utilize, just so people have a reference point.
Yep. Fantastic. And we've actually partnered with the AACDS for this podcast. So we're going to have some offers at the end, what we're going to talk to you guys about, which is very exciting, and some links that you can follow if you'd like to get more information at the end. Yeah,
if I could jump in and remind any doctor listeners, particularly based in Australia, that it's actually going to be important moving forwards to re-register your license every year, that you have to prove that you're doing your CPD, and you have to join what's called a CPD home. So, depending on your specialty, whether you're a dermatologist, GP, plastic, or me, cosmetic physician, your CPD home will live with a various body, like the Medical Board of Australia or the Royal College of GPs or whoever. And what Izzy was saying about these formal courses, diplomas, online courses, you will actually need to do some of these to prove that you're continuing your education to get your registration. So it's not necessarily optional. I think it should be mandatory that you choose something that you're interested in, actually throw yourself into it, because you're going to need certificates and proof of your continuing learning.
Yeah, totally. The next point I'd like to raise for consideration, for both of you guys really, is do we need to look at redefining what it actually means to be an aesthetic practitioner, whether that be a doctor or a nurse, given that we're now starting to look at things from a preventative perspective when you're treating someone for lines and wrinkles and volume loss and broken down structures in the skin, and you're treating them with dermal fillers and toxins and so on. We're looking at, okay, well, how do we potentially slow down the aging process? What can we do to restore your vitality, bring back that glow to your skin, looking like you're a human being, not a worn out corpse, which a lot of people feel like that's what they look like, right? So do you think that at some stage we'll redefine what it means to be an aesthetic practitioner? I know you said, Izzy, you can't be a master of everything. This is kind of arming yourself with an area within this that sort of suits what interests you and what you're passionate about, and then having a team around you that can sort of refer and support this person from a 360-degree perspective. But what do you think, Jay?
I think that, the specialty of aesthetics or injectables, let's call it injectables because that's what we're often doing, it sort of came out of nowhere by mistake. Gene Carruthers discovered how to relax some frown lines, and suddenly we had a new field of medicine that just sort of spiraled from there. So I don't think it was sort of a mistake or an intention that aesthetic doctors only dealt with the superficial signs of aging. That's just sort of how it started. And, if you really scrutinize what we're already doing regenerative medicine. Many doctors are using PRP or injectors, should I say. Exosomes have started. Polynucleotides have started. We have the biostimulators. We have things like Profilo to regenerate and restore collagen and elastin. So we're kind of already doing it. We've just kind of mistakenly stumbled across it, and we haven't really defined what we're doing. And I think people like Izzy have probably thought about it much more explicitly and have chosen to go 2 or 3 steps further to deal with, menopause or hormones or some of the drivers of aging. So I don't think anyone's wrong. It's just we've stumbled into this and we haven't even thought about what we're doing. Well, what do you think, Izzy?
I totally agree. And interestingly, so with the biostimulators of sculpture, it was actually first created for people who are on the old school AIDS medications with lipoatrophy, because they were still discriminated against. And then we obviously realized that we can use that to treat one of the, the external signs and symptoms of aging, which is volume loss. So it is absolutely something that we've kind of stumbled into and have accumulated these tools. I think ultimately the definition of aesthetics is dealing and modifying people's external appearance or their aesthetic identity. We were back in the day we were augmenting, and augmentation was a really big trend, a few years ago. And now we've shifted into more of the wellness aesthetic kind of appearance, which is, you look well, you look like you, as opposed to a carbon copy of, 50 million other people. Like we all know the type.
Yeah.
But I think aesthetic medicine, that definition still stands as it is. But I think what is changing is our patient and what the definition of our patient and person that we're treating is. It's no longer someone who is coming to us just to treat the external. We actually probably see our patients more so than what they do their general medical practitioners. We have such a capacity to be able to hand over health literacy to help guide them through life, to help them actually be, we can actually be a really strong reference point for them. I'm not saying, go out and be best mates with them, but you can actually be a really solid source of health knowledge for them and help guide them. And the way that I like to see people and the way I always vision people, and even myself, is what creates a physical person. Well, it's 3 things. It's their internal health, it's their psychological health, and then it's their aesthetic health. And so their aesthetic health is a reflection of what's happening in the psychological and internal domains. And you can't have any one of those without the other. It's a connected triangle. They have to all exist together for us to create the person. And so aesthetic medicine is probably more about actually connecting all of those dots together. And, is the aesthetic sign and is the aesthetic presentation a sign of an underlying, psychological dysfunction? They're having a terrible time with their partner. They're just feeling really worn and haggard. They're just not coping with life. So cortisol goes up. It's showing with more wear and tear on their face. Or is there an internal health problem? Are they low in iron that they weren't aware of, and therefore they're getting dark circles underneath their eyes? Yet what they're presented with is looking fatigued. And so I think aesthetic medicine, we're still dealing with the exterior, but we have to consider what is the drivers of that symptom. And it might actually just be, they've lost a little bit of weight. They've lost anterior volume in the cheek, and therefore it is sinking down. It's a one-stop treatment versus it's the psychological and internal health drivers that will make a problem persistent or recurrent.
Yeah. I think it's also worth saying, and maybe balancing this, and maybe I'm showing my own bias here, but how we look, regardless of health, just anatomically, if we're lean and we don't like that look, like it's also valid to just treat the aesthetic. You've got a big nose and you're born with a big nose and you don't like it, go and get a rhinoplasty and it'll make you feel better. Potentially. I'm not saying that's the solution, but But
that's because there's a discordance between your psychological health. There's dissonance between what you perceive yourself to be and what you want yourself to be. Yeah, absolutely. That's where we do need to treat the aesthetic.
Yeah. So, I guess what I was saying is I don't think that regenerative... I do think that regenerative is going to play a massive part as we move forward, as we learn more, we upskill and we adopt more services into our practice. But also the aesthetic is perfectly valid as well. We know that, some of the studies have shown that just using toxin makes people feel better. Patient satisfaction from using any injector was through the roof compared to many other modalities. Mm-hmm. So we know that people just look and feel good just by filling a crack on their face. It might seem a bit simplistic and a bit silly and maybe not dealing with the underlying aging process, but the net result is the same. Yeah. You feel better.
Yeah. But it's the opposite is also true if you're someone that's depleted in a hormone. For example, a man in his 50s that's got low testosterone will show in his sleep, his ability to put on lean muscle mass, the quality of the skin, mood, self-perception, all those kinds. So, I don't think there's a hard and fast rule. I think, as we said, it's all part of the same pie.
Yeah.
And we need to make it all work together. So, Izzy, just sort of, maybe just because we've covered a lot of information, we've sort of thrown a lot of stuff at the wall, but maybe let's just sort of, if I was a patient coming into your practice, right? What does the process look like for you? So how do you sort of go through that consultation process, and sort of when do you address certain things? Because in conversations that we've had, and you mentioned briefly at the beginning of this podcast, is you won't treat someone just for aesthetics and you won't treat them just for integrative / wellness. You're looking at the patient holistically. So what does that process look like for you?
Firstly, a lot of work from my front of house team to ensuring that the patient who is calling us is appropriate, and we'll start that screening process with them. Mm-hmm. Once they're, in the room with me, it's always the history, and I always start with, what's brought you in to see me, and that, I don't have them sitting in the procedural chair because I don't want that pressure being placed on them. I have a different chair for them to sit in so that we can have that conversation, and they will walk me through what their concern is and how they answer, and what they answer is really important because it gives me a lot of information. So, my bread and butter kind of patient group is women in their 40s to early 50s, generally well-maintained, and just starting to notice changes that they're unhappy with. And so they'll explain to me what's making them unhappy. And as they're talking to me, I'll be watching for things like, what's their effect like? Are they coming across to me as depressed? Are they highly anxious? Because that's going to tell me about their, psychologically, what's their state like? Because I'm often looking for hormone shifts during this age group. And then I'll ask a few other questions. And the next one is always, how's your sleep? Because when they present with their problem, if their sleep is completely out of whack, then I know I really do need to focus more on the internal wellness side of things. But if they then screen completely and utterly positive, like, they're completely fine from all the other wellness domains, I go, you beauty, let's get started on your aesthetic treatment plan. This is a really straightforward process. And so it comes down to a targeted history, and my brain works as a flow chart to start with the big question, what are you here for? And then I'll start to pick out pieces of information that are going to affect when I deliver a treatment plan, how I deliver a treatment plan, and what is the likelihood of the success going to be, because that's the ultimate goal here. I need to be successful and the patient needs to be happy. And so gathering as much data as I can beforehand is going to increase the likelihood of me doing that effectively.
Right. Okay, so you did that initial consultation process. You've worked out whether or not this is something that needs further investigation, or they're happy to go straight ahead with aesthetic treatments. So how do you sort of balance or sort of navigate those waters between addressing immediate aesthetic concerns and then sort of long-term health outcomes?
It's going to depend on the severity of symptoms, if there is any signs that there's an internal dysfunction. My passion is wellness. So for me, someone is well when their sleep is good, their energy is good, their mood is good, they're able to move around and do all the things they wanted to do pain-free, and their metabolic system is all stable. So if there's only some mild signs, they get energy crashes between 2 and 4 p.m. or they get sugar cravings at the end of the day, that to me is mild metabolic dysfunction. That's not going to have a profound impact on my treatments. The likelihood is they don't want to lose, 10, 15 kilos. But if they're sitting there presenting to me and they're like, well, not only am I getting those symptoms, but I want to lose 15 kilos, then I need to be more careful about proceeding with certain aesthetic treatments. It's really expensive living in 2024. They're making an investment with me, and some of these treatments, they're going to thousands of dollars. And so I have to be judicious about when we implement them, because I don't want to make the mistake of implementing something too early. They go and lose 15 kilos and then we've got to do it all again. So severity of symptoms is realistically probably the biggest defining point of, can I proceed with this patient now with the full treatment, or do I need to separate it out into a treatment plan? So like I mentioned, the metabolic system, big changes in weight is absolutely one I have to consider. Sleep, if they're running off, less than 4 hours of sleep, and that's been a chronic pattern, that to me is a person who enjoys being well. That is actually my biggest focus. We need to figure out right now why are they only living off 4 hours of sleep, because we have studies to show that if you go for more than 14 days with less than 6 hours of sleep, your capacity is effectively that you are drunk. Technically, they probably don't actually have capacity to consent to my treatment plan if they're running off less than 4 hours sleep for the last 6 to 12 months. And that's something that we need to be aware of. So when that happens, I'll treat for the sleep problem. I use supplements. I've got medications I like to use, and I follow up them very quickly within a month, and run blood tests alongside of it, make sure there's nothing majorly off that I need to refer them out for. As soon as their sleep is more normalized, then I can integrate their aesthetic treatment plan. But again, severity is what's affecting that. 6 to 8 hours broken sleep, but mostly feel pretty good. You can go ahead with treatment. It will just optimize it.
I was going to ask, Izzy, so you do your consult, sounds very similar to mine, to be honest, apart from maybe less focus on what am I going to, I ask about, general health, weight, sleep, psychology, many of those things, but I sort of end there because I'm not armed to do anything about it, or I can refer, but I don't have any sort of blood tests that I would do in-house, or I don't know, any other tests. So what can you do in-house? Like, do you do bloods at your clinic? Do you send them to a path lab? What sort of, do you have a routine screening test that everyone gets, or are there specific panels for particular symptoms?
So the last year and a half has really been actually dedicated to creating that framework. All protocols, because protocols make that whole process really efficient. You collect the information, you make sure the patient isn't so unwell that they can't go ahead with treatment. But the next step to that is as well, what protocol can I create that allows me to collect that information, do something about it, and then also deliver aesthetic treatments within a reasonable time frame. So when they start to screen for problems, absolutely. So blood tests, I have a routine screening panel. It's actually pretty similar to what most GPs will do. I'll screen for your essential vitamins and minerals, so your irons, your B12s, magnesium, liver function, kidney function. Always screen for thyroid, and then sex hormones. Absolutely, vitamin D is commonly insufficient or deficient. Anything that's under 100, and I know the functional medicine college is in supporting this, is that we should have vitamin D levels over 100. So I can do all that sort of stuff, and then screen for their sugars, what their fasting glucose, what their previous HbA1c, all of these as far as to date, these are all Medicare subsidized. Yeah. So the goal is that we get them doing blood tests that subsidized, get a picture of what's happening in their internal health, and then, proceed from there.
Right. Yeah. I mean, I actually think that doctors like yourself or myself, we could actually perform quite a big role for the wider public health system by doing these tasks. Not every GP has the ability to screen every patient and check in on their sleep, and sort of almost like a bit like a car service, just sort of like go back to the car service analogy. Not all doctors have the ability to do that. In fact, they definitely don't. So we could actually perform quite a big service to nip these things in the bud or find things early. So I think it's all valid. I just I'm curious to know how you get your patients to sort of get on board with it, because even just getting patients to understand their skin versus their facial architecture is a challenge for many injectors. The patients come very rigidly tunnel visioned into what they want or what they think they want, and getting them to think about, let's have a look at your hormones and your vitamin D. It may be loosely associated with what they see as health, but that's not what they're there for. So I'm really curious to know how you onboard people and what you communicate with them.
You highlight to them where like life, has become less enjoyable. You really highlight to them that they're operating at a 6 out of 10, but they deserve to be working at a 9 out of 10 or 10 out of 10 level. And the reason that I can see that they're only operating at a 6 out of 10 level is because their sleep is deficient, because they're struggling with these wild mood swings at the end of the afternoon because their body isn't regulating their sugar properly. And then suddenly they go, that's not normal. I thought that was just part of aging. No, they're actually signs and symptoms that your system, although not broken, it is showing signs of dysregulation. And, the other concept I give to them is things like type 2 diabetes don't happen overnight unless there's been a horrific trauma or a horrific illness that has occurred. They have to take time to develop. So what I tell my patients is when I see their blood glucose levels and, they're sitting above a 5 but below a 6, I'm like, you're pre-diabetic. You're on your pathway to being diabetic. You also show the clinical signs and symptoms of being diabetic, which is sugar cravings, those energy crashes, and just starting to get amotivated. And suddenly they go, I don't want to get diabetes. And you're like, no, I also don't want you to get diabetes, because not only does it affect your internal health, it also is going to affect how you heal and you respond to my treatments, and you bring the two together. You want to really meld their aesthetic health and wellness to their internal wellness.
Yeah.
And it just comes through screening and having those, we all have them, one-liners that help get patients over the line for us.
Yeah.
I think we've kind of done this to ourselves as an industry, and I'm happy to put my hand up and say have been part of the problem being involved in chain clinics. And though, chain clinics have done a lot of good things for the industry, I think that in some ways we've commoditized these treatments. We've advertised, come and get your cheeks done or get your lips done for, X number of dollars. So we've trained patients or prospective patients to essentially pick a treatment like they're ordering a steak at a restaurant and telling the practitioner, whether it be a nurse or a doctor, I want that. And I think that the changes that have come through now, whilst I'm on the fence around, big government and too much control, I've got my own sort of personal concerns with that kind of thing. But at the same time, I can also look at the positives, which is we need to get rid of the cowboys. We need to take ourselves more seriously as an industry. We need to look at our patients more holistically, and we need to educate them. This all comes down to education. If patients don't understand, then how can we expect them to make the right decisions? And it all starts with us being better practitioners.
Yeah, I am all for the removing the menu of services so patients aren't picking and choosing like a McDonald's, and making it a medical model of a consultation, and you get diagnosed and examined and an appropriate treatment if appropriate. You might not get a treatment, who knows? So I'm all for that.
Yeah, you don't just walk in and say, I want I want a knee replacement. You go to an orthopedic surgeon and you get x-rays and you get get assessed, and if the procedure is appropriate, then you'll get it done.
Yeah.
So in terms of chronological age, biological age, there's genetic tests that you can get now. And I was talking to our good friend, Dr. Felix Bertram, a couple of weeks ago, and he was saying that he did a genetic aging test, and it showed that he was like 79 or something years old because he's sleep deprived. He's, runs large dermatology practices, and he was horrified. So what can you tell us a little bit about like what that is? What are we looking at when we're looking at sort of a biological age versus a chronological age, and sort of how do we address that?
So chronological age is purely the time that's elapsed from point of birth until now, today, for the individual. And it can be used, I feel, as a screening tool for me to predict what systems are going to be imbalanced and what symptoms they're likely to have. But that's pretty much all that it extends to. It's a screening tool. So when someone comes in, I ask them, do you mind if I ask how old are you? And they go, late 40s. I know I definitely need to screen for hormones and sugars because that's a really common one. When you get into your 50s, more likely on top of those ones as well, we're going to see issues with mobility and joint pains. So chronological age can be a screening tool for biological age, but biological age is this idea of how well are your systems working in synchronicity. There's this there's something called crosstalk, which is where distant organs can actually talk to each other in ways that we still don't quite understand. But it's the idea, if you have a negative frame of thinking, you will elevate your cortisol, and then you go into a stress response. It affects your sugars, you get more inflammation, wear and tear. So biological health is how well are those systems cross-talking to each other? Are they cross-talking in a positive manner? And if there is an area of insufficiency or dysregulation, such as driven by sleep deprivation, we see inflammatory markers go up, or we see markers associated with stress states go up. And ultimately, good biological health comes from when we feel that we are safe, we're an apex predator, and we're content. So that's really what biological health is looking at, is how far have we deviated from that, and how much wear and tear have we accumulated, and how close are we to having complete system breakdown and therefore, death or incapacity.
So is that something that you routinely use in your clinic, or does everyone get a biological age sort of, cheek swab, or how does it work, and why would you use it?
So we do offer it at LUCell, but mostly my passion comes from, and I'm sure yours is the same, Jake, procedures is my first love within aesthetic medicine. The wellness side I do is, and what I offer is to optimize their outcomes to my treatments and our treatment plan that we make together. The DNA test is starting to get into areas of functional medicine that I like and I think are good, but do I want to be integrating them into my day-to-day practice? No. There's only very select patients that I offer it to, because they're the ones that I feel really need it, or, we've developed enough of a rapport. We're kind of at that next level where I go, actually, let's see what your system is showing. Let's see what your biological health is doing, what your DNA is going to be doing in the long run. But is that my primary passion? No. And I feel that if I was to just make everyone do DNA tests and everyone to do gut microbiome tests, I'm going to spread myself too thin, and then it's going to impact my ability to give good results in, the procedure side.
Yeah, this is where I have confused myself when it comes to, I guess, functional health and screening tests, and maybe even regenerative medicine, because, you can do DNA tests, you can do stool tests for microbiome, you can do, 100 other things. And the question is, what should you do? And where does business and making money as a clinic blur itself with actually looking after the patient? And how do we make these decisions to actually use these tests appropriately? I think there's a lot of, I don't want to use the word pseudoscience out there, but there's a lot of confusion about what should we be doing, both as patients and practitioners. So, what do you think, David? Because I know you're heavily into this, and if you don't mind me saying, so you sort of throw yourself into anything that will give you an extra 0.5% to be better. But how do you scrutinize the data of that thing to make you better, that hacking process?
Sorry, can you just find the question a bit more clear?
You will do anything to give yourself an edge, and let's call it biohacking for want of a better word. And so, I mean, joking aside, my wife last week, she gave me a shot of methyl blue because she told me that, this is going to help you carry more oxygen in your blood cells. I was like, okay, all right. And I did a bit of reading on Google. I was like, okay, I'll do a one-off shot just to please you. But then I read about it. And of course, there are consequences to taking methyl blue as well. So there may be people out there, I'll get to my question now, who do anything because they've read something on Google that will make them better, stronger, live younger, healthier, whatever. And some of that might be true, some of it might not be. And then as doctors, we have screening tools like biological aging tests and stool tests, but what should we be doing? What is appropriate? Or are we just wasting our money at, use the word, quackery?
So is this your question to me? How do I just... I mean, I sort of work off the 80-20 rule for most things in life. So I look at all the things like that are obvious and easy to do. So nutrition, I think that nutrition is the easiest one to get right. I mean, that's what every cell in your body is made up by what you put into it. So if you put shit in, you're going to get shit out. I've said that before on the podcast. So diet's a big one for me. Sleep's an obvious one. Exercise, avoiding processed foods, avoid unnecessary stresses. So for me, that's probably like 80% of what I can do to optimize my health without going into all these sort of, extreme sort of measures like, and sort of red light therapy. I've just started that as well for like certain injuries that I've had before. I'm looking at peptides. I'm on HRT, so I'm on low grade testosterone replacement therapy under the care of a doctor. So for me, those are probably 80% of the things that I can do relatively easily that are going to make a big impact on me. But beyond that, I'd probably be going to, someone like Izzy, and I'm already starting to talk to her about things that I can do, and she's given me some great information already. So for me, it's the 80-20 rule, stuff that's easy to do. And I mean, I can't stress enough about food. I mean, it's like if I just look out in the world today and just talk to people. People don't cook for themselves anymore. They've got no regard for like what ingredients are in their food, what's causing inflammation in their body, eating takeaway all the time, not drinking enough water. To me, these are easy things that you can do, and it doesn't need to be expensive. It's just about having an interest in prioritizing, sitting on social media as opposed to being in the kitchen and actually preparing the food that you're putting in your body. I don't know, Izzy, what do you think? Am I looking at it too sort of basically?
No. I think with the invention of medicine 2.0, which coined by Peter Attia, is that we forgot what we actually were, and we whittled ourselves down to a series of pathologies, as opposed to what type of system we are, what our system needs to thrive. And I totally agree with you. I think we've shifted away from the basic foundations of what our system needs. And, there's a really interesting, I was talking about the food and takeout and processed foods, and really the exposure to plastics is becoming more of an issue. What we're putting into our body, we really need to actually be making sure we're getting food from the source. There's been a recent article published in Regenerative showing that, in 2024, 150 patients who presented with a cardiac dysfunction, of 270, they had polyethylene in their erythromas. So they actually managed to get the plaque out, and it showed that there's microplastics in it. So knowing what's in our food, knowing what's in our environment, knowing what we're exposing ourselves to, and choosing what stresses we are exposing ourselves to is so important, because the rate at which we do life is so much faster. And I think we're kind of blundering through things that in 20 years' time we'll look back and go, why on earth did we let ourselves get exposed to that? Why were we not focusing on home-cooked food? Why were we constantly getting takeout that was microwaved in plastics and therefore exposing us to these harmful carcinogens and, products? I think we forget the big picture too quickly. And I think that 80-20 rule is so important. And that is the one that I always say to my patients as well. Like, you need to be doing this basic stuff. Because there is only so much that I can do for you.
Yeah. I mean, just to talk about microplastics, I mean, they're in our water. So you can get home filtration systems at your house that will filter out, all the nasties in your water, including microplastics. And plastic in the body is an endocrine disruptor. So that can affect a child's development, what their hormone levels are going to be like, which can affect their psychology, their development into an adult. I mean, that's just looking at the water. As very, am I wrong, doctors?
No, at all. I think the rate at which we're accumulating different stresses is becoming overwhelming in our food, in our water, in our air, in light pollution, noise pollution. There are so many stresses that we are exposing ourselves to. So we have to really take control over what we have in our life. Yeah.
I mean, just look at the amount of kids now that have allergies, they've got depression, they're on antipsychotics, people that are struggling with weight issues. I mean, and we're more medicated than ever before. We're like every, third person I know has got cancer. My dad died of cancer 2 years ago. I mean, it's just like, are we not noticing how sick we are getting? And even with all these medications, we're sicker than ever before. So something's not right.
I think our attention span is shortening. And I mean, if you look in China, for example, the average age of onset of breast cancer is now being diagnosed at 42. Within our population, it's about 50. So we are accumulating stresses, and we're not noticing the patterns and trends, and we're focusing on the problem as opposed to, how often are these problems occurring, and why are these problems occurring, and what do we need to do to fortify our system? We keep forgetting the health of our system first and foremost. We only become aware of it when it breaks. We take it really for granted, and we only notice it when it's not working so well.
Where do you stand on because we're now living to 80 plus? I don't know what the average age is, but something around 80. Do you think that there's also something to do with the fact that because we've extended our lifespan way beyond what used to be about 40 when we were cavemen, or probably even earlier, do you think that some of these things like cancers are inevitable? I'm certainly not disregarding everything else, with diet and stress, etc. But do you think that we're supposed to be living this long? Because one of our goals is to try and live longer, but is that right? I mean, it's a bit of a controversial question, I guess.
I think So my opinion on what life is that you live the best possible life for as long as possible. When we develop conditions like cancers or, heart diseases, the question is it because of degeneration within our system and therefore a failing within our system, or is it because we've been exposed to an environmental pathogen that we shouldn't have actually ever been exposed to, i.e. asbestos? So I think to say that we definitely shouldn't be developing cancers, I think, it's part of the aging process that we do get holes within our immune system. But developing cancers as a result from environmental pollutions or, microplastics or heart disease from microplastics, that to me is not what should be happening.
Yeah, easier to manage.
Yeah. There's also a difference between the quality of life that you're living. So, you might be able to be held together to the age of 90 by medications, but you're bed bound, you're getting dementia, So, I mean, it's not just about how long you're living, it's about the quality of your life.
Yeah.
I mean, if I look at my grandfather who's 98 years old now, I mean, he still uses a mobile phone. He sends me text messages. He reads a book a week. But this is someone that's kept fit his whole life. He hasn't eaten crap food. He makes sure he does 2,000 steps every day. I mean, he's an outlier. But I just think it's not just about living long, it's about the quality of your life. Yeah. And so I think that's another factor we need to look at. I mean, I'd rather live for like 80 quality years than live for another 10 and be miserable and hate waking up every day and be in constant pain. Yeah.
And this is what's really interesting as aesthetic practitioners is because patients come to us because there is a deviation from the baseline where they feel happy within themselves, or they feel that their life isn't as good as what it could be. And I think it's at that point that we have the opportunity to really actually educate them. There's dissatisfaction within your aesthetic health. There are going to be other things that will occur that are going to make you unhappy, either psychologically or internally. These are the ones that I'm aware of. These are the ones that I feel that I can help you with. Let's run it alongside of it while we go on this aesthetic journey with you. And I think, Jake, for yourself, I'd be really interested to know, who would you say your patient is, your ideal patient?
Ideal, but also people who tend to come, I call them positive agers. They're sort of early 40s plus. They are a bit like your patients. They're relatively, professional kind of backgrounds, often in corporate jobs, starting to notice signs of aging, and, generally females.
Yeah. And I mean, that's where we have, and this is where we can build such great rapport with these patients, is we have the knowledge and skill set, we have a basic understanding of the human body where we can go, I know you're presenting with this, but I also know that over the next 5 to 10 years, your hormones are going to shift and it's actually not something to be scared of. Let's just start the conversation now. These are the things that you can look out for. Please let me know if you start to develop them, because I'd love to make sure, that you remain as well as what you are today. Again, I want you functioning a 9 out of 10 to a 10 out of 10. I think we all want that for our patients. We all want them to leave our office and go out and thrive in the world, come back and tell us about all the wonderful things that they've done, and we help keep them balanced. So I think that's why aesthetic medicine is starting to take into this regenerative and functional medicine, because we do have the capacity to give them more than what is available from your general GP practice.
Yeah, I actually do have that chat, but I end at, this is what we or you are going to do about it. So I will say, of course, your hormones are going to change at some point. You may notice that your sleep changes, your mood changes, blah, blah, blah. And I would, recommend anticipating that. Look at your mother. When did she go through menopause? Or look at your friends. What happened to them? What did they say? Are some of them on hormones or some of them are not? Talk about it. Yeah. And anticipate these things.
Yeah.
And obviously from an aesthetic perspective, I'll manage that bit.
Yeah, and destigmatizing that conversation. So many women are like, oh, it's taboo, don't want to talk about it, this sort of stuff. The more that we push our patients to have these conversations, the easier it is to take away the taboo and stigma around, aging. I don't think aging is a bad thing. That's the only way that we're going to gain experiences. And we then fear age because of what we perceive as losing. We lose capacity to psychologically, aesthetically or physically. And I think arming people with the knowledge around what's going to change, again, we reduce that uncertainty. We're able to protect them from not deviating so far from that baseline they want to have. And for you, Jack, having that conversation is so, so, so important, because it gets them thinking about it. And you've also then given them the knowledge to understand what symptoms and signs are indicating that there is an underlying hormone dysfunction. And if it's not your interest to be able to, treat with hormones or do the screening because you're like wanting to be purely procedural, that's you being very aware of what you want to continue doing and doing it really, really well. The only thing I would recommend is find someone who has an interest in the hormonal component and be like, great, these are the symptoms to look out for, and I know exactly the person who's going to do a wonderful job of looking after you. We're bringing our network together.
Yeah. One of the things that often gets missed with sort of holistic patient care is that person that acts as the conduit between all the different areas. So you might have a GP, but then they're going and seeing a cardiologist or a neurologist or what have you. So are you that hub? Do you become that hub for that person, that sort of overarching contact that is making sure that everyone's talking to each other, everyone's aware what the patient's sort of potentially being prescribed, there's not going to be any crossover or, things that are potentially going to impact what some other doctor is recommending or practitioner is recommending?
That's a really good question for, I guess, like what's happening within my practice. So there was a time where I was just doing wellness consults and I did take on that role, but it became so overwhelming because of the sheer volume of patients we had coming through. So what I've realized through trial and error and experiencing it is that, when I look at my practice, it's a triangle. I've got the foundational patients, which are my procedural patients, and they're my easy ones. They're all otherwise very, very well. They get their basic supplements. They might get a little bit of optimization here and there that I can manage. And then as we work up, the patients get more and more complex. For the patients who I'm doing that degree of involvement with, it's limited to probably less than 10. And there is no capacity for me to go beyond that. And I'm very selective about that because I don't want to give poor quality care or to let things go through the cracks. You have to be so much more involved. And I think with the way that we're set up as medical practitioners, it's not like lawyers or accountants where you charge based on a hourly or 15-minute allocation. You're charging them based on a consultation type or a procedural type. And so it gets very grey on how you can, how your time is valued when we don't even know how to value our own time. And so the way that I protect myself while we're, our industry is changing and probably starting to shift towards more time-based, commercialization within our industry, I go, my limit is 10 and that's it. I have 10 patients that I'll be there for every blood test, or I'll be involved with their specialist. I'll be involved in that crosstalk between all the specialists, but I can't do more than that.
Yeah, I think that's fair. And it prevents anything slipping through the cracks or patients feeling undervalued or whatever. That's really good.
Exactly.
Where do you stand with supplements and vitamins and things that you might give to patients to take home and sort of monitor these things? And what do you routinely prescribe or sell or whatever in your clinic?
Your wife is going to love this answer. I love it. I think everyone should be doing it. I think naturopathy is the most underappreciated, specialty in medical specialty within Australia. I think they are the first and foremost kind of wellness specialty, particularly from a diet and supplementation point of view. And in light of, we're so busy, we are so time poor. Cooking, back in the 1950s, 1960s, it was very much the nuclear family. The wife stayed at home. Her full-time job was actually providing the food and nutrition for the family. And now we're entering into this stage where we're all at work. We don't have the time to do this. And we have to accept that, we know that caloric restriction is really, really good for us. It helps with autophagy and all these sorts of things. So how do we engage in these things that help our bodies, but without depriving us nutritionally? And so that's the crux of it. And pretty much everyone is vitamin D deficient. I always get really happy when I find a patient who isn't, but I think of all of the patients I've screened, there's been about 3 of them. Everyone's pretty much vitamin D deficient or insufficient. Low levels of iron, B12 is often on the lower end of the spectrum. We are absolutely a magnesium deficient society. And that has implications for bone and muscle health. A lot of tension headaches can be treated or tension problems can be treated with magnesium glycinate. It helps with muscle recovery. It helps with sleep quality. And then there are some other, branching off into thereby basics that everyone should be on, including collagen powders, really important. They're just providing the building blocks for our body to be healthy. The next ones are kind of then targeting areas that the person feels imbalanced in. So is there energy rubbish? Well, I'd be looking at things like tyrosine, vitamin D, CoQ enzyme 10, to help support that energy system. And then, at nighttime, if sleep's off, L-theanine is going to help with as a precursor to GABA. We've got magnesium glycinate and L-tryptophan, which is an amazing precursor for melatonin and serotonin. So it's about, again, trying to get people to be operating at a 9 out of 10 and 10 out of 10 level. It's very easy to incorporate into our clinical practice. I use a platform called Vitally to prescribe these ones. There's also another one called Designs for Health, but Vitally by far is probably the one that naturopaths use most commonly. It's super easy to set up, and I get my front of house staff to help me with the prescriptions of these.
Great. And so patients can generally get these without a script? They go to a pharmacy or like an online store and just buy them, or do you have to prescribe them?
So just like with anything, there's always, it's a spectrum. There's always good products and there's always bad products. And it's the bad products come down to those that have poor quality control within their manufacturing lines, or there's lots of excipients that they're not, being honest about. And so it's my job then to always pick the products that are quality. You can certainly go and get these over the counter, but within Australia, there's so many restrictions around dosing. Like, for example, the maximum dose of vitamin D that you can get in Australia is 1,000 units over the counter, or 7,000 units as a pharmaceutical prescription, and that's only once a week. That is honestly not enough, because we're relying on the fact that their absorption is good, that their transporters are good, and that they're able to make the most of that. 1,000 units just doesn't cut the mustard. So we're having to use other products to help get those levels up. So I recommend the prescription-based ones and, reaching out to your main set of companies. I really like using Metagenics, Orthoplex. Orthoplex particularly, they're an Australian-based brand. And we know that the standards of manufacturing here in Australia they're rigorous. Yeah. When you start looking at products from China and stuff, we know that there are issues around the standards of care that are delivered not only in manufacturing, but then also in transportation and what they're exposed to. So, I've been using the prescription-based ones, using approved online platforms that are verified with the Australian Naturopathic Board, which Vitally absolutely is, and then any other kind of special ones that you might have to get from elsewhere.
And I'm assuming that you keep a pretty close eye on those levels once they've started supplementing, right? Because I guess the other side of that coin is supplementing is great, but as you said, how much of it being absorbed? The body's constantly trying to keep itself in equilibrium. So if you've got an overabundance of a certain mineral, for example, like zinc, and is it zinc and copper? I think is it zinc and copper cancel each other out? I think it's one of those. Yeah. So if you take too much,
B6 is another one that people overdose on quite commonly.
Yeah. So a lot of people just go out there and just take supplements, and they're just taking this, this handful of just tablets every day with supplements, and they don't really know what they're taking. Do they actually need it? Am I taking too much? Is it being absorbed? Is it potentially like I'm just throwing my body into some sort of chaotic state because it's trying to balance itself and you're just giving it too much of something?
Absolutely. And that's where educating them on how to read their body self-awareness. And that comes down to, when I was talking before about what makes a person the internal psychological and aesthetic health, that psychological health, that ability to have self-awareness around what your system is telling you is really, really important. And so those basic supplements I start in people, the collagen powders, vitamin D, magnesium glycinate, all really, really well tolerated. The risk of toxicities with those is almost non-existent. Yeah. So you start with the safe ones, you get them used to taking them, you start to build up that reservoir. But things like B6, iron, copper, zinc, absolutely you can overdose on those. B1 is another one that is quite safe, but B6, we have had a case recently in Melbourne. I was speaking with one of the ED physicians. They did come in after a B6 overdose. So supplements are medications. You do need oversight.
We did do a podcast with Fiona Tuck, I can't remember which episode it was, about collagen and supplementation. And I just wanted you to give us a sort of a bullet point, because there'll be people listening to this going, well, I heard collagen supplements don't work, and some people are very pro them. So just what's your bullet point take home on collagen supplementation?
And before you kick, so Fiona Tuff, anyone that hasn't listened to episodes, is a nutritionist who's joined us many times before, and she's got her own products called Vitasol, who we're partnered with, by the way.
Yes.
So tell us, Izzy.
So in dot point, there is evidence to support hydrolyzed collagen supplements in supporting collagen production within the system. It's a form of protein. The evidence is supportive of doses over 10 grams. How it is hydrolyzed and how it is extracted will impact directly how your body absorbs it. So poor quality collagen supplements, low doses, they're going to do donuts. You need to get high quality products. So over 10 grams, ideally marine-based is best, but they do work. They absolutely do work. And I think everyone should be on one.
That's actually really interesting because Fiona said exactly the same things. So those were her key takeaways.
Yeah, exactly.
Yeah.
So where do you sort of recommend dietary changes versus supplementation? So, for example, things like organ meats, like liver, for example, that are high in retinol, they've got copper in them. We eat flesh meat all the time. We don't eat organ meats anymore because it's been culturally sort of a no-no, especially in Western society mainly. Yeah. So, where do you sort of make a decision between, hey, you actually need to get some more fruit and vegetables in your diet. You need to start eating potentially organ meats. You need to start looking at, drinking more. Like, how do you sort of work out what the recommendation is, and when do you recommend supplement versus dietary changes?
So diet is king, first and foremost, but the reality is that accessing organic fruit and vegetables is very hard. Most people are getting stuff off the shelf at Coles and Woolies, which has been sitting there for 6 weeks. Nutritional index of that declines. So it's actually much easier for me to guarantee that they are getting a specific dose that they need for their dietary intake with the supplementation. So diet is king. And if they can get access to the good quality stuff, first and foremost, because we do know that when we just rely on supplementation, we get disruptions within our gut microbiota. Don't ask me what the specifics are. I just know that we need to be eating food and chewing, so the process of mastication, swallowing, having it go through our gut and our digestive tract is the best way for us to support our nutritional system or our provide the nutrition for our system. But supplementation is the next best thing to prevent insufficiencies or deficiencies.
Right.
And then it comes down to the individual. Are they vegan or vegetarian? Are they Presbyterian? Are they putting limitations on what their intake can be?
Fair enough. Now, I'm mindful of time and we're going for about an hour and a quarter, but if we could wheel this back to our listeners and mainly injectors listening, this would have been a fascinating discussion. I'm sure we can do 100 other podcasts sort of spinning off this one, but how could they, just summarize, how can they practically think about how maybe in the future they could adopt some of what you've said, both from, regenerative aesthetic treatments that they might look at, as well as some of the more holistic things that you've mentioned? And again, how can they sort of train, and which courses do you recommend?
Yeah. So for what I would call an in-clinic framework, so when you're sitting with the patient is, as the practitioner, you need to know what your interest is, who your ideal patient looks like, and then become familiar with what system imbalances they're most likely going to be exposed to. And then you branch off into different tools. So supplementation, health education, which is your diet, exercise, what is normal sleep, and then what kind of changes within their system they're likely to experience at that point in time. So metabolic dysfunction, hormone dysfunction, and tailor your screening process to incorporate all of that, and then learn ways to be able to implement them efficiently. So that's where, the online prescriptions of the supplements is really easy. It becomes an auto renewal sort of process. If you want to be introducing blood tests, you have, a set of blood tests that you always have available that you can quickly flick to the patient, and you catch up with them in 3 months' time. And you review the results then. It's about systematizing that process. And then in terms of accessing education, in-person stuff with people who are doing what you want to do is probably the best. But in terms of doing, online structured learning for doctors, everyone needs to be doing a fellowship within Australia, in my opinion, whether that's in aesthetics or regenerative medicine or a combination. Equip yourself, because we will be expected to have this under our belt in the future. For nurses and doctors who are wanting to upskill, generally speaking, finding, diplomas that are validated by companies like the Cosmetic Physicians College of Australia, by ACAM, who are our current governing bodies for aesthetic medicine. They know where the good sources are, and then you can go and do further research on things that interest you and accessing those diplomas. So AACDS, I've really enjoyed working with the breadth of work that they're putting out there is something that is going to interest everyone. And then as I mentioned, health cert's been around for a really long period of time. I did my diploma in clinical dermatology with them. So yeah, they would be the main ones that I'd be referencing. You want to go to the big companies.
Yeah.
Okay.
I feel like we could go on forever, and there's a whole lot of topics that we didn't get to, such as, LED therapy, infrared, ice baths, cryo chambers. I'd really like to talk to you about hormones, particularly for peri and postmenopausal women, vaginal health, something that you're sort of very big on as well. So I think we'd love to get, assuming Jake agrees with me, we'd love to get you back.
We need to tackle all of this.
Yeah, we'd like to come back and really discuss those areas as well, because I think there's a lot of things to unpack and sort of educate our listeners on. Yeah. Before we sort of wrap up, we'll just talk a little bit about AACDS or the Australian Academy of Dermal Science. So as I said, you've worked with them before. You developed a lot of their curriculum. They've partnered with us on this episode, and they're actually offering our listeners a 10% off all of their professional certificate courses that they can do. And two of the ones that we'll just give a shout out to is the professional certificate in integrated health and dermatology, and the professional certificate in vaginal health and rejuvenation. So we'll put all the links to how to contact these guys at the bottom of this podcast, and you just pop in the cart there, the IA10 code, which is a standard one we do for all of our partners, and enjoy a 10% discount off those courses. But they offer a whole other range of things as well, so you can go far beyond that. But those are the two that I just wanted to mention in this episode. And just to sort of wrap things up a little bit, Izzy, and sort of, Jake can comment on this as well. As I said, we have reached a crossroads in our industry, and I'm talking to my mentoring clients, in Australia and abroad, and everyone's sort of saying, well, it's getting harder in the injectable space. We're coming under more scrutiny and regulation. There are so many providers. We've got all these advertising restrictions. To me, getting on board this next wave of integrative or functional health is the opportunity. So everyone jumps on board an idea when it's established, and that's what's happening with aesthetics. We've just seen this massive workforce just come out of nowhere. As I said, you can throw a rock in any direction in a major suburb in Australia and hit an aesthetic practitioner, whether it be a nurse or a doctor. So I'd encourage those people to actually start looking at things more holistically, jump on this next wave, educate yourselves. As I said, we've got some great opportunities to sort of go and do that. But I think this to me is the next logical step, and those that have become the early adopters and start to diversify their practices are going to be the ones that are going to be successful into the future. What do you think, Jake?
Look, like I mentioned before, I think many injectors haven't even realised that they are doing a bit of regenerative medicine already, albeit from an aesthetic perspective. But challenge yourself to sort of look at the data better. So if you're using exosomes and you don't really understand them or what they do or what the dose is or where they've come from, that's your first port of call to actually really understand what the hell you're doing. And then from there, like Izzy said, look at your typical patient group. If they are perimenopausal women, well, start doing a deep dive into some of these professional certificates that we've mentioned. Then, from there, start talking about it with your patients and just build on there. You're not going to become a guru overnight, but, you're probably doing some of this stuff and you don't even know it already. Yeah. But build on that and explicitly think of your next 5 years as you can call yourself an injector or a holistic doctor. I don't know what we're going to call ourselves in the next 5 years, but think about where do you want to be in 5 years and how are you going to get there? It's not going to happen overnight, and it won't happen by accident. You have to design your career. Yeah. So looking into the future and thinking ahead. And I think this is how you start to differentiate yourself from all the sea of competitors out there that are offering similar things. How do you stand out from the crowd? How do you become that healthcare provider, that nurse or doctor that is irreplaceable? They can't just go to the next place down the road and get the same service. They're coming to you because you've got something that's special and that you've taken the time to educate yourself on and giving them a service that they're not getting anywhere else. So you don't think we're going to have Regenerative Clinics Australia in a mall soon? I don't know. Look, I don't know. I mean, watch this space, I guess. We will see. Yeah, fair enough. Well, thank you, Izzy, for your time. Really appreciated it, and it was really good to talk and meet you properly. I know David was sort of behind a lot of the planning of this, and we'll certainly have to plan some more episodes on some of these more niche topics. Yeah, so guys, if you like this content, make sure you let us know, because we're largely guided by what people want to hear and what education on. Obviously, we have the discussions that we like to have as well, but if this area interests you, please let us know, because we'd love to
really take some further deep dives on these discussions and really flesh this out and be on the forefront of educating people.
Yeah, if you're not a Patreon, the best port of call is just DM us on Instagram, so Inside Aesthetics Podcast. All of our links are down below, as well as, of course, from our sponsor to talk about their offer and their certificates.
Fantastic. And Izzy, we might have to get you on at some point to provide some Patreon content for our members as well, because I think there's some really interesting discussions that we can have there too. So thank you again so much for your time, and looking forward to catching up with you soon.
Really appreciate it, guys. Hopefully I'll be speaking to you all again very soon, and we can go through a bit more of the protocolization. We'd love to do that.
Thanks, Izzy.
Thanks.
See you later.
Hey guys, we hope that you enjoyed that episode with Dr. Izzy. Jake and I are in the process of putting together some webinars with her. So if you are interested in upskilling yourself in this area of regenerative health and medicine, please register your interest by sending us an email, which is info@insideaesthetics.com.
For our latest news, follow us on Instagram at Inside Aesthetics Podcast. If you want to get in touch with myself or David, follow us on Instagram as well at Dr. Jake Sloan and David_Inside Aesthetics.
Join our Patreon for invaluable business and injectable education. Get access to our global community of like-minded professionals, live and interactive Zoom sessions, hints and tip videos, webinars, and more. Head over to www.insideaesthetics.com/Patreon for more information.